industry standard by more than 30,000 dental and 1.4 million healthcare providers for capturing and sharing self-reported healthcare data, CAQH ProView dramatically reduces the time and cost associated with administrative data collection and dissemination. CAQH ProView offers enhanced usability and functionality over traditional methods for provider data collection. Developed by the nonprofit alliance CAQH in collaboration with dental and health plans, the solutions enable dental and healthcare providers to use a single, secure, online process to share their professional and practice information with one or multiple plans. We're fortunate to have two of CAQH's top leaders with us today to explain how CAQH ProView improves the business processes for dental health plans while annually saving on re-credentialing costs, substantially reducing the processing time for initial credentialing applications, improving data quality, and reducing return mail. Ann Brisk is the Director of Business Development at CAQH, where she leads a sales and business development strategy and team that offers solutions to payers and other organizations focused on reducing administrative costs in the healthcare industry. Ann previously worked at Optum, part of United Health Group, in a number of roles in their financial services business focused on claims payment and healthcare accounts. Prior to joining Optum, she held a number of product management and business development roles at several established and startup organizations in the commercial payments business, including Bank of America, Visa USA, Bank One, and GE Capital. Ann has deep subject matter expertise in payments and healthcare-related financial services. She graduated from the University of Colorado at Boulder and currently lives in Salt Lake City, Utah. Scott Everline is the sales manager at CAQH. He identifies target clients and markets for CAQH solutions. Scott provides consultative sales to prospective health plans, hospitals, and other healthcare organizations while developing in-depth understanding of an organization's current business activities as they relate to provider credentialing and network management. Scott also manages implementation and training for all new clients and works internally to align industry needs with CAQH solutions. Welcome to you both, and Ann, let's begin. Ann, please hit #6 to unmute your line.
Okay, can you hear me now?
Yes, I can.
Okay, great. Okay, so looks like, wow, we've already had people actually answer this question. So we do have a polling question to start. We just wanted to get an idea of how many people are actually kind of in the rooms watching this, and I see that the answers basically say, for the most part, we've got a handful of people in the room together watching this webinar, and in some cases a few more people that have gotten together to watch the webinar. So we appreciate you giving us that information. We just wanted to kind of understand the audience, and we've got some groups of people that are grouped together. Okay, so I'm going to basically be covering some background on CAQH. It is important to introduce kind of who we are and how we approach, in this particular case, gathering provider data. We're also going to talk about the benefits for providers of all types, and then also from a plan perspective, the benefits for dental and other types of healthcare plans. Scott's going to then take us through an actual demonstration of the ProView solution in terms of how it works, and specifically how it integrates with plans that are using it today. And then we'll also be talking a bit about provider directory, which is very much kind of a hot topic, especially starting in 2016 with the new CMS regulations and requirements. So we're going to talk about ways that we've now incorporated some of those provider directory maintenance capabilities into the ProView solution. And then we'll wrap it up with Stephen handling some questions from the audience and getting wrapped up in a summary of the webinar. Okay, so I'm going to start by talking a little bit more about CAQH, and as I mentioned, this is important context for understanding how we approach building solutions for the industry. First and foremost, we are a nonprofit alliance of health plans that have come together essentially to focus on ways where through collaboration we can reduce administrative costs. So we look at common ways that we can have organizations work together on initiatives in order to get more of the industry to use certain solutions, again, for the real purpose of reducing administrative costs in areas where there's generally not a lot of competition per se around operations, but more so just administrative costs that really just drive the overall cost of healthcare. We're all about collaboration and innovation, and we really try to accelerate these types of processes, which I think you'll see today as you look at the ProView solution. We are actually made up of a number of health plan organizations of various sizes that have come together and actually sit at a board table together and determine the types of initiatives and areas that they would like CAQH to focus on. So you can see we do have a broad range of organizations. This does include oftentimes both their medical plans as well as the dental plans. And all of these organizations, again, sit together at the table and try to determine the types of things that they believe will be best served through collaboration. In terms of some of the initiatives that CAQH handles and works in, first and foremost, many of you may be familiar with CORE, the Committee on Operating Rules for Information Exchange. CORE is really the way the industry comes together to help actually write operating rules for electronic transactions. And CORE is really a great example of collaboration through the industry to not necessarily do things through regulation and requirements from the government, but actually to start to build solutions together that will help us reach more electronic transactions in the industry over paper. We also run the CAQH Index, and the Index is a great example of what we would think of as a benchmarking survey. So we actually have a large number of organizations, including a large number of dental organizations, that are submitting data to us in order to help track the transition from paper-based processes to the electronic transactions that are commonly used in the electronic data interchange or EDI world. The index, we've actually just now released a new version of the index, so we basically always released it 1 year, 1 year later. So we've got data in there for 2015 and 2016, and we just released a new version of the index that is available for free on our website. And again, it's a benchmarking survey, so you can really look at it to understand where you sit next to some of your peers in the industry. We have a number of other solutions that we've built which are really, again, designed around bringing the industry together, such as COB Smart. This is a collaborative solution where we take all of the health plan membership, and this is coverage of all different types, into a single database on a weekly basis, and we look for overlapping coverage between plans. And then we report that information back out. So that's a good example of the industry coming together, putting data and information together that normally they would never share, but in this case for the purpose of identifying overlapping coverage and paying claims correctly. We're going to talk more about ProView today, so I won't talk too much about that, and Direct Assure, which is the directory maintenance solution that we built on top of ProView. Our sanctions track solution is actually sits right next to our ProView solution, and that is actually a way that we gather all sanctions for all provider types across the country and report those back to the organizations that have used ProView for credentialing. So it's a good way to be able to look at sanctions before you bring a provider into your network, and then also to keep track of them on an ongoing basis to see if they have any issues. And then finally, CAQH Enroll Hub, which is our EFT ERA solution to help organizations of all types drive the conversion from paper-based checks to ACH and starting to receive their claim payments by ACH. We know in particular in the dental space, we've worked with a number of plans that generally dentists sometimes lag behind in this area, so we're seeing a lot of momentum as more plans really get behind it and start to ask their dentists to participate. Okay, so I want to take a moment to ask a polling question. to the audience. So this one is really kind of asking that basic question of how do you currently collect your provider data today for the purpose of credentialing? Is it mostly paper applications, or is it online? So you actually have you shifted to getting all of that information online, or is it a combination of both, which is fairly common? And we're starting to see the results come in. So it looks like it's kind of a combination of both. So it sounds like there's been some, at least, movement to offer a digital application. And it looks like kind of what we're starting to see, which is slowly but surely providers are starting to use those types of solutions, especially if they're mandated. Generally, when we've been talking to plans, we do see very much kind of a split between the two. And a lot of it just depends on particular provider relationships and what's going to be easiest to get that provider into their network. So thank you for answering that question. Okay, so now I want to give just a general introduction to CAQH ProView for the purpose of credentialing. So what's most important to understand about what we built with ProView is that it has actually been around for a long time. We originally launched it in 2002, and then after many, many years of a fairly straightforward application and system, we decided to completely redesign and relaunch it in order to be able to expand our capabilities in 2015. So we just went through a pretty big relaunch just about 2 years ago. In essence, ProView has become the healthcare industry standard for a universal provider credentialing application. So just to take a step back, the basic concept when we started was that every organization had their own credentialing application made up of their own required fields. Those applications were typically on paper. So one of the first steps is we wanted to move everything to an online application that providers could put their information in once and then maintain it over time. So if it's in an actual system, they would be able to access that and maintain it. In addition, the entire industry basically said we would like to get to the point where we're all using the same data fields. And so we came up with this concept of a universal provider credentialing application. What that means is providers of any type will fill out the same application and they will supply that information to organizations of any type that would require it. There's a lot of variability between different provider types using the system and different requirements for that information. So what we were focused on is we wanted something that the output was always the same for any organization that wanted to use it, and that they could automate bringing that information into their systems because the output was always the same. So essentially what that's become is the default solution for much of the industry to be able to exchange this information. Today we have more than 1.4 million providers, both standard, so we think of those as all of the doctors, the various types of doctors, and then all allied providers are using CAQH ProView. And we have roughly a 50-50 split in terms of doctors versus all the allied provider types. More and more care is being delivered by allied provider types, so we're seeing a lot of growth in that area. And then we've got 15 years of experience, so we've been doing this for a long time. And we have over 800 different organizations, so not just health plans, but hospitals, network-based organizations, dental plans. A whole number of different types of organizations are actually coming in and getting this data from us today. So it's grown to be quite substantial, but it didn't happen overnight by any means. We also have essentially nationwide adoption of the CAQH ProView application. So different states have come to understand the benefits of ProView over time, and 12 states plus DC have adopted the CAQH provider credentialing application as their standard application. It is also widely used in the 25 states that don't have any specific credentialing application requirements. And then 13 states we've actually programmed to be able to provide an output in the unique mandated form that state requires all organizations to use. So from our perspective, providers come in, they give us all their data, and then we can create the right output for the various states that meets those particular requirements. And as you can see, that's a lot of work to keep up with all 50 states and everything they're doing. But basically, we kind of handle that for the plans. Okay, so I'd like to ask another polling question. So one of the areas that we see kind of just basically the heavy lift, if you will, of bringing a provider into a network is just around getting their complete credentialing application. So just getting the basic information you need, including all of their documents that they would submit. So on average, is it taking you less than 14 days, somewhere between 15 and 30 days, 31 to 45 days, or is it taking longer than 46 days to get all of that information? Looks like we've got kind of a broad range. Looks like no one's doing it in less than 2 weeks. Quite a few are getting it really within 30 days. Oh, looks like we've got a little bit still coming in there. And then kind of some that are pushing out a little bit further. And I would imagine some of that can also depend on the way you're collecting that information too. So one of the benefits we're going to be looking at for ProView is that when a provider comes in, they complete their entire application and they have to keep it up to date and reattested. And that can make this particular part of the process move much faster. So you'll know right away if there's a completed application in ProView. You don't even have to bother the provider. You just need to have their CAQH ID, and you can go grab that information and get the process started. And that's really the concept that's worked very well on the medical side of the industry, where providers know their information's in there, and they'll tell the plans that they're working with, here's my CAQH ID, just go ahead and grab it, and then you can start the primary source verification process. So thank you for answering that question. So one thing to note about the ProView solution, and Scott will go into more detail on this, but it really does contain a very wide range of data elements. This is important because what we found over time is that organizations that are accessing the data need a lot more information than just the basic credentialing data in order to bring a provider into their network and contract with them. So we do collect a very, very large number of data elements, but again, from a provider perspective, most of it is one time. So they can put it in the system. Most of these things don't change over time, and they can just keep that information up to date. So all of the required disclosures, all the disclosure questions that are asked, personal information about the provider, all of their educational information and background, which again generally doesn't change with the exception of some of the CLEs, all of their professional identifications and their training that they've completed, specialties, which they might add to over time if they continue to get additional qualifications. Any professional references can be passed through the system. All hospital affiliations, so all the different hospitals that they're allowed to practice at, that's especially important in oral surgery. Work history information, so we do make sure that we have a complete background with no gaps for work history. Practice information, so all the places that they're able to practice, information about their ability to accept certain types of patients at those locations. Their liability insurance information, and we do require an actual face sheet to be put into the system, so we've got accurate, up-to-date information on their malpractice. Sanctions information, which we basically check through the sanctions track solution that we'll talk about. And then all of the ProView identifiers. So we're putting together a very complete, robust set of information that ideally means that the plan does not have to go back to the provider to get additional information once they've completed the credentialing process. The idea is to be able to pull it all into the system, get them set up in their network as quickly as possible so you can start paying them. Okay, so let's look at this from a provider perspective. So why would providers like this? And we do get quite a bit of feedback from providers as we frequently talk to them about how much they do appreciate the ProView solution, because it does make their lives easier, and that's really what we're trying to do. So first and foremost, it's free to providers. That helps a lot, obviously. So they can use the system, put all their information in, realize the downstream time and cost savings, but they don't have to pay for it. It's a single provider profile, again, a universal application that can be given to any type of organization that needs it. So whether they're working with a leased network organization or with a medical plan that would like to pay them for medical type claims for surgery, or if it's just with a straightforward dental plan. So it's one application, and that data, again, can be given to a variety of different users on the back end. There's web-based workflow flags for errors and incomplete information, so we really make sure that the provider is very aware of the solution and making sure that they do have a complete application in the solution. We've tried to make it as user-friendly as possible, especially with the relaunch. There's a lot of information they have to get through, and we try to explain each step in the process so that they can complete the process. We do have robust security features. This is the provider's data. That's how we think of it. It is not our data to sell or anything else from a CAQH perspective. This is the provider's data, and they are giving us permission to make it accessible to the organizations that need to contract with them. We added a new feature when we relaunched to allow providers to come into CAQH ProView and basically preload all of their information. And then as soon as a plan organization identifies them, we then allow their information to flow to that organization. So we always want some organization to actually identify the provider, so we make sure that they truly are a provider and someone does business with them, and then we can allow the information to be shared. We do capture all of their document images for their licenses and board specialties. We capture all of that information through scanned images that get uploaded into the system, and all of those are available downstream, as Scott will show you. Updates can be made at any time and are immediately available, so we actually require providers to come in and reattest every 120 days so that their information is current according to NCQA standards. So they will frequently come in. They may not have any changes, but they can reattest that everything's the same, or they can make simple changes within that 120-day period, and then that gets passed to any organizations that work with that provider. We do allow practice managers to use the system and manage multiple locations and providers. So we have a kind of a set of features that allows them to make their work easier. And then all of this is supported by a large call center team that actually takes a lot of phone calls from providers as they're going through this process. And we also do support them now through live chat. That's very important. There's a lot of interaction that has to happen to get a provider through this process and get all this data correctly loaded. And we do support that through the ProView service team. From a dental plan perspective, so first of all, the number one thing is that the plans are able to receive the most complete and up-to-date self-reported provider information available. NCQA does require that this is self-attested information. So the information from a provider perspective needs to be accurate, and they are the ones that are essentially vouching for what they put into the system, even if they may not be the ones that actually put it in the system. There is a secure electronic exchange of the roster information and the provider data. So we allow plans to tell us via a roster of their providers who they would like to receive information for. And then we then connect them to all the completed providers that are in the system. So all that is done electronically. We do also have a portal where smaller plans are able to do that via the portal too. All this information that we send back then is sent in electronic files. And again, oftentimes that information can be taken and put into other provider data systems where organizations are tracking all the contract information and other aspects of the network information for their providers. Again, the provider does have to reattest every 120 days to make sure that the data is current, which is what the plans need. We're constantly enhancing our system. Recently, we've done updates with the U.S. Postal Service to make sure that we essentially normalize all the postal addresses that are in the system. So that's just something that will basically provide better quality addresses that are coming back through to the plans. And then plan support, again, through a dedicated support center. So we do take all the phone calls and deal with all of our 800-plus organizations through a call center. And then we're constantly doing outreach to providers to encourage participation. And in fact, we're in a pretty big push with many of our plans today in order to do outreach to dental providers to ask them to come into the system. So we're constantly doing that and reinforcing why it's in their best interest to do so, and that's part of our solution. Okay, now I'm going to hand it over to Scott Everline, who's going to go through the actual ProView system and show you what it looks like.
Thank you, Ann. So I'd like to go go through the process for ProView as far as how providers interact with CAQH, as well as how plans then get the information back from CAQH so that they can do the steps that they need to do to get the providers in their network. On the provider side, so as Ann had said, providers are continually reminded throughout their experience with CAQH to log into ProView and review their information and then attest to that credentialing information. That life cycle is every 120 days that will send reminders out to the provider community to get them back into the system and reattest that information. The signature date or the attestation on the application is recognized by NCQA, URAC, and the Joint Commission as a valid signature date on the provider's credentialing application. And then in addition to the attestation reminders, we also communicate out to providers to remind them when expiration dates are about to come up. So things like their license, their controlled substance certificates, such as their DEA or their CDS certificates, and their liability malpractice information. When those elements are up for expiration, we send additional reminders out to the providers to go into the system and update their information. As Ann had pointed out, ProView collects a pretty robust set of data from the providers. So we go beyond the credentialing case and also pull in additional information that can be used through other downstream entities within an organization. Once a provider has their information in ProView, a participating organization, which could be a health plan, it could be a dental plan, hospitals, government agencies, various provider organizations, can request to access that information. Through ProView, providers have the ability to control who has access to that information, however. So a provider must authorize a plan prior to that information being shared with a plan. The organizations will submit a roster, simply a file identifying which providers they would like access to. And then based on that roster file, the provider's authorization, CAQH will then provide data back to the plan in a variety of different capacities, which I'll talk about in just a minute. Ann had mentioned that we're going through an effort with our current organizations, several of our current organizations, specific around dental provider usage. So starting in May of 2016, we partnered with United Healthcare's dental group, Aetna, DentaQuest, Cigna, and CareFirst, Blue Cross Blue Shield. Our effort was really to drive more dental providers from their networks back into for the first time CAQH ProView. The plans expressed a strong desire to get more providers, dental providers, in ProView so that they can continue the efficiencies that they're gaining on the providers they currently have within ProView. The focus here really is streamlining that process of collecting the provider information in a one-stop location. So in conjunction with the providers, we started a pretty strong outbound communication, which is now added up to equal about 75,000 total emails sent out since the beginning of May, really driving providers back into ProView. There are currently 15 standalone dental plans using ProView. So there's a mixture of all types of organizations using ProView, but standalone only dental plans, there are 15 currently utilizing ProView. There are more than 35,000 dental providers currently in ProView with current complete applications, meaning they've gone through the process of completing their profiles, have uploaded the required supporting documentation, and are now available for plans to access that information. So 35,000 dental providers, and that continues to grow as we continue our outreach efforts toward the dental community. And there are over 165 plans that have accessed dental provider data through CAQH ProView. And that could be medical plans that are credentialing dentists for medical services, as well as the standalone dental plans. So the last polling question we'd like to ask is really around how many providers annually are terminated from a network due to a lack of response. So you've heard some feedback from plans, both on the health plan side as well as the dental plan, around the amount of providers that they end up terminating every year from credentialing or from their network because the providers did not respond to their request for credentialing documentation. And it looks like the numbers are, for the most part, sitting right around 100 or less than. Great. Thanks, everybody. Last polling question, I promise. So now I'd like to move on to a demonstration of CAQH ProView. So bear with me while I pull up the screen share. Uh-oh. I apologize. We actually ran this through a test earlier last week, and it worked perfectly fine. And of course, on the day of, technology always fails us. So thankfully, we were prepared for this. So I have some screenshots that I will speak through as we kind of go through resemblance of a screen share. So bear with me while I skip through a few slides here. Okay. So CAQH ProView is a web-based tool. There's no installation of the service itself. The users can log into ProView using any internet browser of their choice. And once they're in the platform, using a unique username and password, they have access to their organizational account. It is a very standard user interface platform, very easy to navigate. So when a user first logs into ProView, they're going to see on the home screen several kind of frequently used options. So there's a location where the user can perform a quick search, which would just be a quick first name, last name lookup of a provider. There's also a message center sharing any key messages from CAQH to the organization user. There's also a provider status report. The provider status report is a quick snapshot of providers that are on a current plan, on a plan's roster, and what their status is. So really looking at where that provider's application is within the CAQH ProView system. Administrative users can also manage additional users. So unlike a lot of solutions, ProView is actually not a licensed agreement, so accounts can have unlimited number of users with a variety of user roles to kind of manage access. Organizations from the home screen can also upload their roster files, and they can also download files directly from the home page. So true to the graphic user interface nature of ProView, there's a navigation bar along the top. The home button will always return a user back to the main screen. The account information is only available to administrative users, and that allows them to manage additional users and also make changes to the organization's information, such as billing contact information or even changing alias names for the organization if known by another name in a surface area. You can also look up providers. So in addition to the quick search functionality that's on the home screen, users can use an advanced search feature as well as add new providers to ProView for providers that have never been in the system. Keeping in mind, net new providers can also self-register. There's also a files and reports section, and that's where organizations would upload roster files, extract data files back from the system, as well as look at our sanctions reports. And then there's a resources tab, which provides additional documentation around resource documents, sample files, extract dictionaries, and accreditation letters from the various accrediting bodies that support CAQH. So from the user screen, as I had mentioned, administrators on the account can add, delete, or edit user privileges. And of course, there's no limit to the number of users on a single account. The provider status report provides a visual of the status of the providers on your CAQH ProView roster, and specifically to the status of those providers individually. So here you can run a detailed report, which will provide you specific information to help identify which providers are in a current status with CAQH, meaning they have logged into the system in the last 120 days and reattested to their data, or whether they're in an expired status or an incomplete status. Once a provider is, to get a provider onto your ProView roster, you could use a search, so whether it be the quick search or an advanced search. On the quick search feature, we don't need very much information, simply a first name, a last name, if require the primary practice date, so I would recommend using that for more common names. If an organization user has the provider ID, they can provide that, the CAQH provider ID, and you can also narrow the results down by providing a provider type. The advanced search allows more search criteria to be utilized, so things such as zip code, provider date of birth. If the provider is on the organization's roster, you can also look up by last and next re-credential dates, as well as various other fields. The search results come back, and they provide the provider name, the provider date of birth, the primary practice date for the provider, the roster status, meaning what is that status of the provider with the specific organization, so whether the provider is on the roster, not on the roster, or inactive on the current roster. And then we'll also share the provider status, so where that provider is again with CAQH, whether it's a current application, expired, or incomplete. By clicking on the provider name on the results page, you gain access to the provider information. To add a provider to the roster, you would simply click on Add Provider to the Roster, which is an option on the left-hand side of the user screen. And you'd be able to share additional information that ties directly that provider to your organization. So whether it is an organization-specific provider ID that you assign, whether or not the provider is par or non-par with the network, delegation status, and then of course last re-credential date and the provider's next re-credential date. These are all optional fields, they are not required. However, a lot of plans find them to be very helpful when pulling the information back through the system or running reports later on. The provider detail page provides an overview of the provider's information as it is in CAQH. It'll let you know the provider's roster status. It'll let you know the provider status as it is to CAQH and their last attestation date. It also provides some key identifying factors such as the date of birth, last four of the provider's social security number, their last attestation date, practice information, professional IDs, and when a plan enrolls in our sanctions track solution, they would also be able to see easily whether or not the provider has any actions against their license. Once authorized by a provider, plans can view their information in a variety of different ways. Organizations can pull up a data summary, which is a simplified version of a credentialing application, or they can pull the replica application, which is an exact replica of the CAQH standard application or the state-mandated application, depending on where the provider is practicing and what application the plan requests. You can also pull historical versions of the application as well. So if you want to go back and look at an older version of an application and see what information was available through ProView at that point in time, you can also access that. The data summary, again, is just a streamlined version of the replica application. So it houses the same information. The information is just packaged in a more consolidated manner. It's easier to view, and there's fewer pages. So if a plan were to choose to print out information, they could print out the data summary and save a few pages of paper. The replica application, as Ann stated, is available both in the 37 states that CAQH supplies the standard application, or the 13 states that have state-mandated applications. This is dictated by the plan as well as the provider's primary practice location. So the provider has a practice location in one of the states where they have a mandated application. The system will automatically populate that. And if the provider practices in more than one state, the system will automatically generate the correct application using the ProView supplied data from the provider. This, of course, helps plans stay within compliance with all state-mandated applications. From the reports page, you can schedule application reports. This is really driving back into the billing. So looking at an application report from a provider, specifically detailing the providers that are on your roster and on an invoice, as well as a general invoice statement covering the last month's costs. This is a snapshot of the provider's attestation screen. So from a provider perspective, when they log into CAQH ProView, they're required to reattest to their information. And with the addition of Direct Assure, we have added a directory snapshot to the provider's information so that that provider can review their directory-specific information and make sure that's accurate when sharing it back with the plans. And that would conclude the screenshots of the demonstration. So bear with me while I move back through that information. So I touched on Direct Assure, and Direct Assure is really focused on the recent regulations around provider directories. A challenge that the industry, both plans and providers, are facing is around the multitude of requests that are going out and ways to consume updated information in a timely manner. New federal and state regulations have made this a more important element in a lot of the plans. Currently, a lot of plans are sending out emails, faxes, direct mails, phone calls, anything they can do to get the providers back into the system and re-engaged. What we're finding from the provider community is that multitude of requests are becoming onerous on the providers. With Direct Assure, CAQH has addressed many of the regulations regarding outreach requirements, so performing quarterly outreach to providers, reminding the providers to review and update their directory information as it's housed in CAQH ProView, representing or presenting a directory snapshot to the providers, as seen in the previous slides, and then sending updated information back to the plan so that they can consume that information in a timely fashion, and then also provide a compliance report that allows the plans to represent what efforts have been performed as far as outreach requirements are concerned. So in summary, CAQH has more than 15 years as a trusted solution and the industry standard for collecting provider self-reported data. We've seen increases in provider satisfaction by eliminating the duplicate credentialing applications for each plan. Providers show their engagement in a real-time capacity with a standard reattestation rate, meaning providers have been into the system within the last 120 days. That rate rests at 85%. And ProView also reduces the time and resources needed to collect that information. It also reduces data entry errors and delays in processing. With Direct Assure, we're expanding on the ProView case, taking information beyond the credentialing need and utilizing the trusted ProView platform to help streamline collection of directory information as well and help plans comply with new regulations. Now I'm going to turn it over to Dr. Keller for any questions.
Well, thank you both for a very informative presentation. We're now open for questions. You may type in a question by clicking on the chat tab on the left side of your screen. So let me begin. So how do the company fees normally work with CAQH? So if an insurer wants to enroll, is there a flat fee, or if they have 30,000 providers, it's different than 50,000 versus 100,000, and is there a sliding type scale? You don't have to tell us the exact pricing, but just so companies will know if they want to engage how that is scaled.
Yeah, Scott, do you want to? We're actually fine sharing the pricing because it's standard in the industry, so we can just kind of share the basics of it.
So it's a little bit of a mix. So there is a standard fee of $3,000 per year per organization. There is a one-time $2,000 implementation fee, and that covers a lot of the back-end programming to get the organization built within the system, as well as handles one-on-one training for the organization, so making sure that the organization understands how to utilize the service. And then for each provider that they have on their ProView roster that has a current application, so this is applications that have been reattested within the last 120 days, for dental providers, so DMDs and DDS, there's an annual fee of $4.50 per provider. So for each provider on that plan's roster, they would pay $4.50 for a 12-month window of access. So it's not every time the organization would access that provider data, but rather once over a 12-month period of time they would be billed for unlimited access to that provider's information. And there are no additional fees.
Okay. So a question. So if a dentist enrolled in ProView last January 2016, and they were with Company A, and then January 17, they were newly enrolling for Plan B, does that dentist need to do anything different to update things, or does Plan B just say, well, that dentist already is in ProView, so we accept wherever we are at that point, or do they require you to go through checking sanctions and things on that provider again as of that new date?
Sure, that's a great question. So we look at the provider data as a dynamic set of data, so that's constantly changing based on where the provider is. As far as any specific actions that would be required by the provider, it would be dictated by their authorization status. So providers within ProView have the option to globally authorize any organization that CAQH grants access to, or they can limit that to specific organizations of their choosing. So if the provider had global access, the plan would simply have access to that provider data at that point. So Plan B would become a ProView customer. They would roster that provider on their CAQH ProView roster, and then they would have access to the information. If the provider had limited authorization, then we would send a communication out to the provider notifying them that Plan B has rostered them, and then that provider would go into the system, authorize that plan should they choose to do so, and then the plan would have access to it. Sanctions is also an ongoing source. So if the Plan B signed up for sanctions, they would then also have any current sanctions as well as any historical sanctions. So
if that dentist last did their 120-day attestation in October, and now it's January and they're not due really again yet, that provider, you would need to go do sanctions again from October through the time Plan B is seeking to enroll them.
Yeah, just to explain how the sanction solution works,
Sure.
It actually, this is essentially something that the plans can continue to access, and we'll send them updates on all sanctions for all providers. But that's actually something the plan would do in that case. They would access to check during primary source verification if there's any sanctions for that particular provider and make sure that they pass.
Okay. So how can an insurer, before they enroll, determine how many of its providers are currently enrolled in ProView? Would they do sort of a download, and then if you see there's 50% match will ProView proactively look to enroll those providers on their behalf?
So it's something we handle in the kind of the pre-sale process. We welcome to any organization to do a provider match, so we can take key identifiers such as MPI numbers, provider name, date of birth, take that information and bump it up against our database and feed that information back to the plans. Because a lot of times it's more than just whether or not the provider is in ProView, but whether or not the provider is in a current or a complete status. But we can share that information back to the plans, and then with the results of that report, that's something we utilize when we go to perform the implementation processes, is we use that match to populate the roster file that plan's going to upload.
Okay. Okay, so if a provider directs a plan to CAQH, but that plan does its credentialing elsewhere or internally, can that plan get a single file on that provider without fully signing up and paying the annual fee and the integration fee and any other fee associated with that provider?
No, basically the process we have is that any organization can choose to access any number of providers that they want from CAQH, but you still have to pay the annual fee and the implementation fee in order to start that process. So there's work involved on our side to get new organizations set up. Okay. But then, it's really up to them how many providers they want to access. We obviously hope over time and with integration they'll realize the value of trying to get, any provider they can through the CAQH system. And it's interesting, you noted that sometimes it's the providers telling the plans that they use CAQH. We actually get a large number of calls from organizations who have said, look, a lot of our providers have told us they're in your system and they'd like us to use your system. So that is actually why they call us up to access it.
Do you have primary source verification of information supplied by the dentist currently?
Yeah, good question. So historically, CAQH has really kind of stuck to gathering all of the provider data required for credentialing. A few years ago, we made the decision to kind of go ahead and take that next step in the credentialing process to actually not only gather all the data but also do all the primary source verification. And we are in process of launching our CVO service to the industry. So we're actually an NCQA certified CVO as of February, 2016. And we've been doing that work, and we're going live and with many plans and doing lots of the verification work starting this year. So we're just starting now to offer that service.
Great. So in other words, at that point, you'll be a one-stop shop where if insured says, we want to get out of the credentialing business, it creates too much friction or too expensive, and that's not what our primary business is. They'd be able to outsource that entire solution of credentialing.
Yeah, and it's actually a great example, I think, of one of those administrative processes that really doesn't add a lot of competitive value to an organization. It's just something everyone has to do. So it's a great example where we can do it, one time for many organizations and further reduce the cost around the primary source verification process. And really, at the end of the day, you're trying to just weed out a few of the bad apples, if you will, that you wouldn't necessarily want to put into your network. The vast majority of providers do pass muster. So, good example. We will only deliver a completed file, so it's still up to the plans to do the final decisioning. So we'll still put that kind of on their side of the shop, but we will deliver everything they need to be able to make that decision.
And how receptive have providers been in participating with ProView, and are you proactively marketing to them through different sources?
Yeah, Scott, do you want to take that question?
Yeah, so we've launched a campaign in May of 2016 with some key dental plans such as United Healthcare and Aetna and Cigna to really look at their dental community, their networks, to see what we can do to increase adoption. Part of that was also identifying which providers in their network currently use ProView, which I think was, to the surprise of several of them, more than what they were expecting. So as far as providers being responsive to the request, they seem to appreciate the outbound communications. We've seen actually a pretty good increase of dental provider adoption or engagement. So while not all of the ones that we're performing the outreach efforts to are going in and completing profiles, they're logging in, they're contacting our call center, they're definitely expressing an interest in going down the path with CAQH. I think part of that is, and what we've seen strongly on the medical side historically was, it takes a village, if you will. So it takes both the plans as well as the providers to come to the table, and sometimes that's a bit of a chicken and an egg conversation around, if the plans are using ProView, providers will come. If the provider is using ProView, the plans tend to come. So we're working to find that middle on how we can get both sides engaged.
Great. Now, Scott, we've had some questions related to how many providers you have in each state on a state-by-state basis, and a listing of the plans, the dental plans that are participating. So not right now, but can we follow up with you and have you provide answers to the NADP through Lauren, and we can forward those responses to anyone who has an interest?
Yeah, absolutely. So the list of participating organizations is actually published on our website. So that's pretty current. Usually within the week it's being updated. And that can be found at caqh.org. Under the Solutions tab, there's a ProView section, and then there'll be a list of participating organizations there. As far as providers by state, I can definitely get a report for you, calling out specifically how many DMDs and DDS are in each given state.
Perfect. And if we can funnel that through, through Lauren. And the last question, and then we'll move on. And if there are any other unanswered questions, Ann and Scott, I hope you don't mind if we forward them to you, and then we can provide responses to them. As far as the fees are involved for ProView, are there separate fees for Direct Assure and Sanction Track and the other services that you provide?
There are. So for Sanctions Track, the fee schedule is essentially $2,500 per year per state that a plan is practicing it. So say if you're Delta Dental of Missouri, your Sanction Track fee would be a simple $2,500 per year for unlimited listing sanctions, both for providers that are on your ProView roster as well as any providers that are not. So sanctions goes beyond just ProView and just a plan's roster, but it's scouring the universe of sanction sources such as the Office of the Inspector General, Office of Personnel Management, all the various state licensing boards, a couple other federal agencies, Medicare, Medicaid. So it's scouring all those sources on a continuous query, and providing that back. So it's $2,500 per state with a maximum for national plans of $30,000. So once a plan is operating in 12 or more states, it caps out at a $30,000 maximum fee.
Okay.
For
thank you so much on behalf of the NADP. I'd also like to thank all of our attendees for joining us for today's webinar. We look forward to having everyone join us on January 24th for our next webinar, which is free to members, entitled Complementary Accessibility Reporting with Netminder, which will be presented by Aaron Groffman, President of the Ignition Group. Thank you all.
Thank you.